Weight loss surgery is offered to patients who are morbidly obese, and that is a definition that can be done with looking at your weight, looking at your height, and then coming up with a number. That number is called a BMI, or body mass index. There are many calculators that are available to check and see what your BMI is, and I also have one on my website. Morbid obesity itself is a problem because it can result in high blood pressure, diabetes, sleep apnea, and other health conditions. Morbid obesity is also extremely painful for many of our patients. There are a lot of joint issues related to it, low back pain, all things that we can affect and improve with weight loss. One of the great things about weight loss is that freedom of movement that patients experience. They feel trapped in their bodies, but I look at my patients as they're in a cocoon. They're not able to move, and then as they lose weight, they kind of emerge as butterflies. And I know that sounds a little bit touchy-feely, but it really is the truth. They have this new freedom, and the most successful patients really enjoy that freedom and start being more physically active every day. Weight loss surgery works in a variety of different ways. We have restrictive procedures that make you eat less food, such as gastric banding, sleeve gastrectomy, and gastric bypass. And we do all of those through very small incisions, so we frequently call them laparoscopic procedures. And then also there's malabsorptive procedures, which usually encompasses the duodenal switch, which can also be done laparoscopically. Laparoscopic surgery refers to small incisions that we do. This enhances recovery. We also refer to it as minimally invasive surgery, and all the procedures can be done in this manner. With a laparoscopic adjustable gastric band, I'm taking this very soft silicone device, putting it around the upper part of the stomach, and then I connect it to a port that goes under your skin. And through that port, and again, nothing's visible outside, through that port, I inflate the band so that it cinches around the stomach, making you less hungry and having you eat less food. Laparoscopic sleeve gastrectomy, I take out about 70% of the stomach and completely remove it from the abdomen. So it's gone. It can't grow back. It's an irreversible procedure. This procedure, though, also removes some of the hormones that make you hungry, notably ghrelin, and it also affects some of the sugar metabolism in your body because of the nature of the sleeve itself. And because of that, it's actually a hormonal operation as well, and it makes you eat a lot less food. Laparoscopic Roux-en-Y gastric bypass, also known as gastric stapling, but we really, as professionals or surgeons, refer to it as the Roux-en-Y gastric bypass. And that procedure makes you eat less food because your stomach is about 1 to 2 ounces in size. And then we also bypass a significant part of the intestine to create some level of malabsorption. And that combination of eating less and absorbing less helps patients keep weight off for a long time. I do all of the weight loss procedures. I do gastric banding, sleeve gastrectomy, gastric bypass, and I also do revisions for my patients. I believe that all of the operations can work, but each one may not work for everyone. You'll find videos about all 3 of these procedures, gastric banding, sleeve, and bypass, on my website, and I encourage you to watch them.